You know, they didn't plan for it, they don't have the money, but the catastrophic health insurance covers that. On the other side, you know, someone has elective problems, so they have a hernia that needs repairing. In the NHS, we would pay for that. But in Singapore, you would need to put money into a medical savings account to be able to basically find something like that, which is not emergency. And we take all of that and we go home to Nigeria. So Nigeria is special. I think Nigeria spends less than 7% of its budget on healthcare. And that is interesting.
It was like 2.2%. I read somewhere 2%.
Yeah. It's quite variable. The way the Nigerian budget allocates healthcare, they have like a bit they call like capital expenditure and then recurring expenditure. And a lot of healthcare, as we know, is salaries, you know, payroll, paying wages. But if you actually look at the population of Nigeria and you look at the allocation on the budget, Nigeria actually allocates, and let's say 70% of Nigerians live below the poverty line, right? So they're the ones benefiting from the government expenditure. The other 30% are earning enough money to pay out of pocket, as most people do in Nigeria. The government basically spends about 1,500 naira per head, and that is $5. Yeah, for healthcare in a year.
Is this annually?
Annually.
Oh. Ooh.
In the you know what it is in the US? The US, it's I think roughly about $20,000 per head.
Per head, and in Nigeria is 1,500 naira.
Yeah, per head, and that is assuming 30% of the population can pay for themselves. So that already gives us a massive window into the issue. The financing is not there. Now, financing is not new. The US spends the most of its budget, or any country in the world, on healthcare, and there's still a big black hole in health financing. We need more money, and they're not getting enough money. So there's that massive issue. But for Nigeria, one is financing, and the other thing is healthcare behavior, and healthcare behavior is linked to knowledge and information.
Okay.
So at One Doctor, we provide, you know, health services gateway. Basically, if you're looking to access any healthcare service, we connect you through a variety of platforms, ranging from analog, so telephone, USSD, to digital. So we're talking smartphone apps, our web platform. And over the last 2 months, we have been doing surveys, healthcare surveys, to understand consumer health-seeking behavior. And we've done about 500 so far. And what we have found, and we're doing it in the lower income, the 70% of the population. And this is the economic working class. So people, Lagos State. Okay. So Lagos State 1, which is to an extent an anomaly in terms of literacy, in terms of exposure, in terms of awareness and economic power. In our sample size, which is small, to be fair, we have found that most of them do not know what a health maintenance organization is. And these are the guys that do health insurance. We asked about health packages, health insurance. Literally 95% of them have no clue what it is. Then one of our questions is health-seeking behavior. You know, when you're sick, what do you do?
What do you do?
And we asked it in terms of quantitatively, so that we'd have numbers. And I'd say about 80% of our respondents go first to the chemist or to the pharmacy before actually looking for a doctor or anything.
Pharmacy.
Exactly. I should put it in quotes. Spot on.